All right, good morning, everybody. My name is Roseanne Myers, and I'm the founder of Keratoconus, Barbados.
Good evening, everybody. My name is Dwayne.
Okay. All right, so at the end of the day, there are a couple of things that I want to say today that are very important for us as a patient advocate group, and I want to welcome all the others that came out here this morning to listen to the talk on keratoconus and also to basically represent the fact that we believe strongly that there is very much a need in Barbados, that with every major condition for support from persons who have experienced what you have experienced. And you would have seen Dwayne go out of the room at the beginning. That's because, like all of us, his contact lens fell out. That is the story of our lives. We joke and say, if you're ever in a room together and the contact lenses fall out, we're not going to know whose lens we're picking up because they're going to be all over the floor. Keratoconus Barbados was founded on February 3rd, but we started an effort about 3 years ago, just on a social media platform, trying to build a community. When I was diagnosed at 21 years old, myself, like everybody else, we were told it's a very rare condition. What does rare mean? How many people in Barbados actually have keratoconus? Listening to the optometrists, to some of the ophthalmologists, we are seeing cases of keratoconus every day. Keratoconus, although it might be rare, we live with it, so for us it's not rare. It's frustrating. It's very difficult sometimes to get the right prescription, the right fit for your lenses, and unfortunately, we are not necessarily as up to date in terms of the lenses that we're using as we perhaps could be. One of the things I would like to say, certainly in terms of our objective, the number one objective that we have is basically awareness. People in Barbados don't know the word keratoconus. Many know it now because people are calling me in the supermarket the keratoconus lady, and that's fine. So they get it pronounced correctly. My nephew, 8 years old, can say keratoconus and he knows what it is. Our YouTube channel was launched with all of the testimonials so people understand a little bit better, and people are reaching out every day. Yesterday, I did a presentation at the Barbados Hotel and Tourism Association's board. I'm a member of the board. And in presenting, my phone went off because I basically belong to just about every keratoconus group in the world, Australia, wherever. And there was this young man saying, my life is over. I've just been diagnosed with keratoconus. Every day is a struggle. What am I going to do? And, there's no hope. There's no career. And he was just really down. And we don't want anyone in Barbados to feel that way. And we know that we have some people that do. Keratoconus comes with depression. You're depressed because you can't see. Your world is a cloudy and blurred world. So that is the support we want to give. So more than anything, we are a support group here to raise awareness. We've met with the principals of the secondary school teachers. We're going to meet with the primary schools. This evening we have a meeting with the Blind Association, because they're the far end of what we all fear, that one day we will not be able to see. And therefore, on World Sight Day, we want to make it the biggest, best, most impactful World Sight Day Barbados has ever seen in 2019. And we want to get together with all the groups who have anything to do with sight. And that is part of the awareness. And the schools, we want them to buy into helping teachers to understand how to detect when you have a child who is suffering, cannot seem to get any answers because they can't see and they can't see through glasses. One of the biggest issues that we have, people don't believe you can't see because you're not wearing glasses. People say, but in fact, on the way to the launch, a friend of mine said, well, I saw you were driving pretty good, you weren't wearing any glasses. We don't need glasses to see. What we need is something that is purpose-built for this irregular cornea that we have. And that is basically our story. So number one is awareness. Number two, we feel strongly that we need to raise the $200,000 it will need to buy the tomographer for the Queen Elizabeth Hospital. In Dr. Jibber's presentation, you talked about monitoring. So if I have a child, and we had some 6 and 9 year olds diagnosed with keratoconus, I want to know what that progression rate is. I want to know how fast his eyes are deteriorating. I don't want it to be a guesstimate. So right now on the island, we only have 2 private institutions with the correct topography or topographer to be able to do the test. We believe the QEH must have the best of the best. And the medical system that we have, it sends you to the QEH. So the QEH must have that tomographer. We've committed to Dr. Benskin and the CEO that in 6 months we're going to raise $200,000. That's what I said because stuff jumps out of my mouth, right? But we started an effort, and part of it is awareness. People don't know that this is something that people in Barbados are struggling with. So raising awareness, raising some funding. We have some among us who need basic contact lenses and can't afford. I have 3 or 4 people reaching out to me. Had a lady crying on the phone to a friend of mine yesterday. Oh my gosh, I have to join this group because I don't know what I'm going to do. I can't see. The rigid gas permeable lens is not working. What am I going to do? So that is part of the effort we feel we must have. So that's number 2. Number 3 is research. We are not satisfied to say that nobody knows where keratoconus comes from. We are not satisfied to be able to say nobody knows how many people in Barbados have keratoconus. What happens during pregnancy? We did a little survey. One lady says, well, in pregnancy, mine got really a lot worse. We have to understand, is there heredity link? I'm standing here with keratoconus. My daughter has keratoconus. Dwayne is sitting there with keratoconus. 4 people in his family have keratoconus. Tell me that the link is slight. Show me the data. So we believe we have to move away from the anecdotal. Fortunately, last week we had a very nice evening with CORA, the Caribbean Ophthalmology Research Alliance, and we are committed to working with them on keratoconus research. Dr. Barker has been excellent in terms of helping us and guiding us, and we're trying to see whether we can do through him some of the research that will be world understood and accepted research on keratoconus right here in Barbados. A population of 287,000, supposedly a higher than normal number of persons with keratoconus. People showing up. I understand at the school I clinic every single week, little children which they're suspected keratoconus. We have to figure out what's going on. Is there a link genetically? Is there an environmental link? So that is the research that we want to do while supporting the community. Our intention basically is to have a discussion with the Ministry of Health, the Ministry of Education, and through those agencies we already have an agreement from all of the teachers' unions to sit with us, because we have a number of teachers, some in this room, who have keratoconus. We've counted at least 5 from our very small first meeting. 5 teachers with keratoconus. So what is it in the Barbados environment? Well, and I'm told it's not only the Barbados environment. We're told that throughout the Eastern Caribbean, in Trinidad, in St. Vincent, St. Lucia, there are people with keratoconus, and it is something that we really need to study. So our 4th objective is to spread what we are doing here, not only from a support group point of view, but in terms of the research to people in the Eastern Caribbean. So, Keratoconus Barbados, the Facebook page, Keratoconus Barbados, the YouTube channel, everything that we do, including everything that we're doing today, will be on our YouTube channel. And that will help us to be able to spread the word and the message. The kcbarbados@gmail.com. What we're asking the vision care professionals are for some very specific things. We're saying, when you have a newly diagnosed patient, let them reach out to us. People have questions they're never going to ask the doctor. We have experiences the doctor will never be able to understand. And there are many of us in this room. Some of us have had keratoconus and have gone to the point where we need corneal transplants. And we've had corneal transplants. Some of us are walking with corneal transplants for 23 years. Thank you to Dr. Barker. I didn't realize you were actually doing it for that long. But we have people among us who have the eyes that were transplanted 23 years ago and seeing brilliantly. And I will not look at her, but I will steal what she says. I have a black man's eye in one eye, and I have a white man's eye in the other, and they get along brilliantly. That is a phenomenal story. So at the end of the day, I'm saying reach out. I would really like to make a plea I think sometimes we are referring patients too late to the subspecialties, and this must happen in all of them. If you have a patient that has keratoconus, transfer that person early enough that they can get the cross-linking. It's really about patient-centered care. It's not about keeping your patients. It is about patient-centered care. Similarly with the optometrists, we have people fighting with lenses falling out, and there are only 2 people on the island, I believe, that do scleral lenses. Scleral lenses give keratoconus patients vision they have never recorded before. Don't deny us that because you don't happen to be the one supplying scleral lenses. Patient-centered care. So give us the options. I can go piggybacking with the soft and the hard lens in the same eye. I can go hard lens. I can go the hybrids. I can go to sclerals. Now they're computer generated sclerals that are custom fit for your eye. And with the tomography, you can send the tomographic picture or whatever it's called, tomographical image, and they can fit a scleral that is exactly like a glove for your eye. Imagine that. We need to get to that stage, and we're not there. So I believe together, we can tell you what our needs are and some of our challenges. You are the experts. You have to help us to make Barbados the center of the best eye care this region has ever seen. We have all the subspecialties that we need represented, and we have a lot of ophthalmologists out there with a lot of skills. We just need to work better together and make sure when you diagnose us with keratoconus, do not leave us just in the hands of the optician. The biggest challenge with keratoconus is living with those lenses every day. So help us to understand what's out there and what would be best for our eyes, whether or not our particular optician may carry them. But that is the information that we as Keratoconus Barbados will hope to bring to you and to our members. We just started to share information about cost of lenses, and some people buy their rigid permeable lenses at a fraction of what other people are buying theirs for. So we need to share that information so we can say this market needs to get a little bit kinder, perhaps, to the persons with this rare condition, because maybe it's not so rare. At the end of the day, I want to say thank you very much to Dr. Deborah Singh for the opportunity to bring a patient perspective to keratoconus. Rare, but not so rare. And even if it is rare, and even if it's only a handful of us, our lives can be better if we all work together to make sure that we understand the who, what, where, and when of this condition and be able to help others. So email us, kcbarbados@gmail.com, and we would be happy to entertain whether you're a KC sufferer or whether you're simply interested in raising and helping us raise the awareness. And if you have a check that you want to leave for that machine, and I'm speaking to all of the overseas delegates now, who've come here, who've enjoyed our weather. If you want to leave a check so that we can get the $200,000 machine, Barbados dollars, for the QBH, we'll be happy to accept. Thank you.